Thank you for joining us this morning for our COVID-19 Recovery Roundtable video series. While we can't meet together in person, we still want the Alliance to be a resource for all of you. Please also continue to be safe and stay healthy during this time. Please stay home and help us flatten the curve and keep it flat. I also want to acknowledge all the healthcare workers who are on the front lines fighting the COVID-19 outbreak. We cannot thank them enough. Huge thanks to many of our members on this call who have answered our call to help support our community in countless ways. And a special thanks to our event sponsor, Northwest Natural, and we're really lucky to have Catherine Williams joining us today from Northwest Natural. And again, thank you so much. Catherine, the floor is yours.
Great, thanks. Good morning, everybody. It's a real privilege to be able to do this from my home with my working computer and my fast internet access. Thank you, Comcast. I will just say that my children are about to get back on Zoom calls with their teachers, so if I become fuzzy very quickly, I apologize in advance. Northwest Natural is pleased to have many partners, including Multnomah County and the many community action partners to assist with things like bill assistance. And I just wanted to give a pretty sobering statistic just to give sort of an early indicator of, I think, some of the challenges our community is going to be facing in the next couple months. In March, Multnomah County distributed about $50,000 of low-income assistance funds. And just in the first week of April, we have hit almost half of that number. So that just shows us that we are going to need to continue to work as all utilities together on bill assistance for our most vulnerable customers. And I just want to acknowledge what an important partner the counties all over the state, but particularly here in Portland, what an important partner Multnomah County is. So as I'm home, as we all are in kind of this new normal, we're doing some civics lessons in our house. And on Friday, my family watched Chair Kafoury give her State of the County speech. And she was really able to clearly articulate how the county is responding in so many ways to the COVID-19 crisis. And if you didn't have a chance to watch it live, I'm sure that Andrew and his team at PBA can post a link. But for those of you that you didn't have a chance, I'm going to steal a word that the chair used in her remarks, and that is grateful. I'm grateful to have a leader like Chair Kafoury and Dr. Vines at Multnomah County at such a crucial time. They've really been focused on mitigating the very real impacts this public health crisis is having on our community. And beyond the many important services the county provides, she challenged everybody in her State of the County to do something pretty simple, and that's to look out for each other. So we're trying to do that at Northwest Natural. We're trying to do that as a family. We're meeting new neighbors. We're staying 6 to 10 feet away, but we're meeting new people in our neighborhood. And we're really trying to act more like a cohesive community. And I'm looking at that as kind of a bright spot here. With that, I just want to thank everybody at the county for their leadership and turn it over to Andrew.
Thank you so much, Catherine. And you'll notice already in the chat function for everybody following along, you can find a link to the chair's State of the County already up and in your chat bar function right now. So, and again, thank you to Northwest Natural to have an event sponsor to keep the support of the work of the Alliance during this critical moment in our world's history. As I mentioned before, the Alliance is here to be a resource for the business community, and we have set up a page that is COVID-19 focused and is updated frequently with things like the State of the County. Visit portlandalliance.com/COVID-19. Follow us on social media for updates, and you can find us on Twitter, Instagram, and elsewhere at PDX_Alliance. So just a few notes for video engagement details. A recording of this presentation and links for all the resources mentioned will be available shortly after we wrap up this morning. During the presentation, I encourage all of you to converse with other attendees in the chat function. We'll be using the webinar chat feature specifically. And if you have something to add to the conversation, please post it there. If you have questions specifically for our panelists, make sure to use the Q&A option at the bottom of your screen, and we will have time to get through audience questions at the end of the presentation. When asking a question, please make sure to include your company name, your website, and your location. So moving on, this morning we are looking at the county's response to the COVID-19 outbreak and the economic downturn it has caused, what plans the county has in place to support the businesses in this emergency. And really with that, I'd like to welcome to this presentation our Multnomah County Chair, Deborah Kafoury, who is just fresh off of her Friday presentation to the City Club and the state of the county. So Chair Kafoury, welcome. Thank you for everything you've done.
Thank you. Good morning. Thank you, Andrew, and thank you, Catherine. Thanks for the introduction. And thank you to everyone who's tuning in this morning. Fresh off Friday's presentation, I will say in the new COVID world we're living in, the past 2 days have been like 2 weeks. So it seems like such a long time ago. But I really appreciate the opportunity to talk with you all today. This crisis has challenged every one of us personally and professionally. But it's helped me to crystallize in my mind some of the things that make our community special. And for others, it has highlighted the critical role that Multnomah County plays in people's lives. First, we are leading the public health response to this pandemic, and we're making every effort to slow the spread of this virus while making sure that vital safety net services that our community depends on stay up and running. And second, this pandemic has really shown our collective strength in deeply challenging times. And that has been highlighted by the many, many, many businesses that have stepped up to ensure that we still have the vital services like groceries and power delivered to everyone in our community. And by creative ways of suspending utility shutoffs and stepping up with hotel rooms to ensure that people who are leaving hospital or people who are sick have a place to recover. Unfortunately, we have a long way to go in this crisis, but we need to keep working together. And that's why conversations like this one are so important. So I wanted to start by telling you a little bit more about what we are doing at Multnomah County and the role that we are playing to try to keep our community and our economy going through this crisis. My highest priority since this started has been to slow the spread of COVID-19. And I could not have, and we at Multnomah County could not have a better team than the one led by our Public Health Director, Rachel Banks, and Dr. Jennifer Vines, our Multnomah County Health Officer, who you will hear from a little bit later. But I want to be clear and give her all the credit that she is due, is that Dr. Vines has driven the policy decisions that have guided our response. From closing schools and mass gatherings to social distancing and the stay-at-home order, all to support a unified hospital response. And within our local public health division, our communicable disease service response team has 7 investigators, including nurses and epidemiologists, who conduct case investigations on more than 60 reportable diseases from E. coli to measles. Last year, they responded to about 5,500 reports of communicable disease. So this is the work that they already do every day. At the end of February, they began investigating this new virus called COVID-19. Every time a county resident tests positive, this team reviews their medical chart, conducts interviews with the person who's ill and people who've been in close contact with them, and then follows up. And although the staff are still continuing to investigate other person-to-person contagious diseases, in Multnomah County, our investigators are prioritizing COVID-19. The county went from having 6 cases in the first week of March to 160 cases in the first week of April. And yet our public health leadership believes that contact tracing is and will continue to be one of the critical tools to slow the spread of this virus. We've also increased the number of investigators from 7 to 10, and we've added at least a dozen on-call nurses and public health graduate students to assist in these investigations. We're also making data for our 4-county area available on a daily dashboard so that the public can see not only case counts, but hospitalizations and symptoms. So I urge you to look at our website, and they tell me that it's over in the comments panel on the side there, so you can see multco.us/COVID-19 data. As for all our vital safety net services, they remain open and available, from our health clinics to student health centers to domestic violence and behavioral health services. The need for these services does not go away in a crisis. The need for these services has actually increased, and we are doing what we can to be sure that we can deliver these services in a safe and effective way. And that includes our jails, where our Corrections Health Division and public health officials are working with the Sheriff's Office to prevent and minimize the spread of COVID-19 in the jail. Our Corrections Health Division already has a number of protocols in place to respond to an outbreak of a respiratory illness, including isolating individuals in reverse airflow cells. And they've implemented policies like asking people during the booking process about their potential COVID-19 symptoms. They've created a classification dorm of single cells where people can be monitored for 14 days prior to moving into permanent housing. And for the past several weeks, they've been holding tabletop exercises to prepare for a potential and probable outbreak. We've also had to dramatically alter the way in which we deliver our shelter services. These services have never been more vital or more difficult to deliver. From the beginning, we've been implementing the CDC social distancing guidance for our shelters, and that's why we've moved shelter beds across our entire community to make sure as best that we can that everyone is following the public health recommendations. As of today, we've moved almost 400 beds into community centers as well as the convention center. Hundreds of county employees have stepped up, working shifts in our shelters to help launch these facilities smoothly. But we couldn't rely solely on library workers and other county staff to run these shelters. For the duration of the crisis, we needed additional people, especially folks who have social service backgrounds, medical backgrounds, and experience working with homeless individuals. And that's why 2 weeks ago, I launched a recruitment campaign to bring people from the general public, people who might be underemployed or even unemployed, to work in these roles. And so far, we've received almost 700 resumes. And while we're talking about our employees, that brings me to my final point. Multnomah County is a large employer in our community with about 6,000 people on the payroll. So it makes my job, it makes it my job to ensure that they can do their job safely. We can redeploy people to the places where we need them and hire more staff to ensure we have coverage and expertise in the emergency operation centers and in our shelters. During normal times, we help the economy by making sure that people in our community have what they need to thrive. And during a crisis, we make sure that people have what they need in our community to survive. And the faster and more completely we can control this outbreak, the better it is going to be for our economy. We know that we're not going to emerge from this crisis unscathed. And as you all know from our conversations over the past few months, Multnomah County started this crisis in a deficit. We recently learned that the legislature is not going to restore the funding that we need to run our parole and probation and jail operations. You remember that as the Senate Bill 1145 dollars that we thought we were going to get, and we've heard that they are definitely not coming. So as you can imagine, forecasting our revenue projections right now is a real challenge. Our most recent updates have shown our revenue declining, no big surprise. And thanks to your partnership, the recent adjustments that we made to the business income tax will help not only Multnomah County, but the many small businesses that have received a well-timed tax cut. We are just starting to get the economic data that we need to make more accurate projections, all of which is to say things can still change, but how well we do will all depend on how well and how quickly our economy recovers. So I have an ask for you. During this crisis, it is vital that we all speak with a collective voice, that we all carry the same message. So if you have not visited the county's COVID website, please make sure you go and look and try to echo the messages that we're sending to the community. People need to stay home. When they're out accessing vital services, they need to ensure frequent hand washing, proper social distancing, and don't touch your face. If your business is open, please take steps to separate employees and ensure that sick people stay home. And if you have questions, please call on us to help. So I know you have a lot of questions about our public health response, so I'm going to turn it over to our expert, our health officer, Dr. Jennifer Fines.
Good afternoon, everybody. Can I just do a quick sound check and get a thumbs up that you can hear me?
Sound great.
Okay, thumbs up. Okay, great. So good afternoon. It's really a pleasure to join you. There's no question that strong businesses are the engine of any healthy community. And we certainly have not taken lightly the financial and social impacts of our response to this pandemic. I'll just describe briefly where I think we are with this virus. I think we're about a month and a half into our most active part of the response. We spent a couple weeks really putting a lot of energy into the social distancing and clarifying what we meant by that and what the rationale was. And as you probably know by now, it's this idea that this particular coronavirus loves a crowd, and the more we can break up crowds and keep people away from each other, we can't stop the transmission of the virus, but we can slow it down and buy ourselves some time. And I think some of the early data suggests that there's room to think that we've been somewhat successful. That said, there are modeling studies that the Oregon Health Authority are putting out periodically. Anybody who's familiar with modeling, it's only as good as the assumptions that you make. So there's always a grain of salt in the predictions. And the modeling studies are showing that we appear to be quote unquote flattening the curve, which is to say that we are probably spreading out the severe illnesses to give ourselves time to prepare our health systems, to buy some time for personal protective equipment production to come back online, to again buy some time as we have for testing to become more widespread. So basically to give us time to get all of our tools ready so that we don't look like a New York City, for example, or Italy as another example. So the following social distancing, we used that time, we continue to use that time to do a lot of health system preparation. Major credit to our local health systems who have come together with me and with others to do regional planning around how to distribute seriously ill patients should individual systems become at or near capacity. So there's been a lot of talk there and a lot of coordination so that healthcare providers are also speaking with one voice to their employees, whether it's about masking or whether it's about how should we get to the point of having to decide on scarce resource allocation, which means deciding who gets in intensive care unit beds if there's more patients than beds. A lot of regional discussions and consensus building there. So I'm often asked sort of what's next. So right now our peak, or it might look more like a plateau, is anticipated to be near the end of April or early May. Again, that could change, and we have to be prepared for that to potentially change any moment. Again, I feel fairly confident that our health systems and planning have gone a long way. There's still more work to be done. But when I'm asked sort of what follows that, I can give some early answers to what I think might follow. As we collect data, as people get tested, as our disease investigators, as Chair Kafoury mentioned, collect data, we get a better understanding of this disease. We get a better understanding of how it's behaving locally, and in particular, who is most at risk locally in terms of what specific underlying conditions land people in the hospital, what are the age ranges that we're seeing, and that's all on our dashboard. You have the link there in the chat box, and it's some really fine work by our disease investigators, so I encourage you to look at it. So hopefully between what we're understanding from actual cases, again, those numbers driving better and better modeling with real data, more testing coming online, hopefully more personal protective equipment coming online. I'm hoping that we head into this summer with some sense of how we might be able to relax social distancing intermittently, potentially by protecting those at highest risk. We are also hopeful that a lab test called serology, which just means a blood test that can detect antibodies to this particular virus, those are just starting to come online, and as they get more refined, may actually be a way of telling us who has some immunity from this virus, because as I'm sure you all know by now, you can have no symptoms and still have the virus and potentially spread it. So again, preparing for our what we think is going to be a wave of illness that's probably headed our way late April, early May, being as prepared as we can be for that, and then looking always to refine our toolkit, our data, and our thinking to see what is going to be the next best step we can take in handling this virus, understanding that we are probably in a response mode for at least the next several months, with a vaccine in sight probably not until sometime in 2021. So I'm happy to answer questions. I'll just pause there.
Yeah, thanks. I do want to just, while, you've been talking, one thing that I think is really important for most folks to know, and we have 130 businesses that are currently participating on this chat right now, which is great. And thank you for all the businesses out there that are tuning in. Something that is a behind the scenes item that I don't think folks really know about, but I got a chance to connect with you personally, Dr. Vines, is the multiple health systems all in need of this personal protective equipment. And you, in some sense, as the county with the chair, has acted as the hub of all this stuff. Why don't you give a peek behind, what are the chief medical officers telling you? How are you coordinating scarce equipment getting out and back to the health systems? Give folks a sense of how that is happening, because we hear a lot of different stuff about PPE. So let's talk and dive into that for a quick minute.
Sure. So personal protective, you'll hear PPE. That refers globally to different kinds of masks, usually gowns, medical grade gowns, and gloves, plus eye protection, which are the basic nuts and bolts of what our healthcare providers need to be safe. So we had been collecting donations at Multnomah County. The state is also collecting donations, and we've requested Oregon's share of the federal supply that's called the Strategic National Stockpile. I won't say the shelves are bare, but all health systems have gone to a conservation and reuse mode of using their FDA level masks, and you'll hear N95s, which are very special masks that have a tight seal around the nose and mouth to protect healthcare providers who are doing anything with a COVID-19 potential patient that can create aerosol. So those FDA level approved medical equipment, that is what people are keeping their eye on as far as a reliable supply chain. I can't say that that supply chain is reliable at this point, but again, a lot of creative conservation and some new guidance from Oregon Health Authority on how to actually safely reuse and decontaminate some of that equipment. The state guidance also includes some guidance around what would be better than nothing. And we also now have, since Friday, the Center for Disease Control's recommendations around face coverings, also known as cloth masks, for everybody else. So the bottom line is, for anybody who's a vendor who thinks that they can either access good medical grade level equipment, I'm sending them to the state website because they are vetting specific vendors. Multnomah County will certainly take donations of any kind of healthcare level personal protective equipment. We are also taking donations of homemade cloth face coverings in order to distribute to our social service providers and others who may need them. So again, personal protective equipment, we are not in any way out of the woods, but there have been a lot of creative strategies to conserve what we have, again, as we buy time waiting for global supply chains to come back fully reliably online.
Great, thank you for that. Chair Kafoury, I want to start to shift into a little bit of the business story here, because obviously this is unique time, and I think you said something, and it is so consistent with how the business community feels. Clearly, this is unprecedented times, and complying with these executive orders is paramount, because the faster we can get through this, flatten the curve, keep it flat, it means that we can reopen our economy in a more effective and durable way. So I think you said it right. The best economic tool right now is compliance with all these executive orders. So I just appreciate that you reiterate that point, and we share your perspective. In the meantime, it's a question of helping get through this moment. And one thing you did, and it's just really important for our members to know, you delayed the due date for the business income tax to July 15th. That's going to obviously help to keep as much money in the economy as possible. This obviously helps our businesses make payroll, rent, for right now. What are some of the other actions that you have taken or you are considering that would help support the local economy at this time? And is there anything you want our members to know that you're up to right now?
Sure, thank you, Andrew. I do want to first say that the decision that the leaders in this state made to close down restaurants and bars and businesses across the state was really a painful decision. And we, especially at Multnomah County, looked not just to the health implications or not even just to the effects on the hospital, but we really looked to with an eye to the understanding of what this would do to individuals in our community. And because Multnomah County is a safety net, we really do focus on those who are the most vulnerable. That's who we serve on a day-to-day basis, people experiencing homelessness, folks who are elderly or disabled, immigrant and refugee community. And so those groups of folks were already, in many cases, hurting prior to this COVID outbreak. So we've really had to double down on our efforts to ensure that people are safe. And one of the things that we did along those lines was an eviction moratorium to ensure that people could stay in their homes and not exacerbate the already devastating crisis of homelessness that we have in our community. One of the things that we did just last week in terms of providing support for our nonprofit partners was that any nonprofit that is a contractor of Multnomah County received a letter that said, we want you to continue to bill us, and we will work with you to ensure that you can adjust the outcomes that you're expected. You can shift your priorities that you're working on, ways to keep the nonprofits that we work with up and running. That was crucial. Allow them to potentially change focus and shift their support to other areas, but areas that are supporting our community. One thing I will say again is that the scale of this crisis is such that it can't be solved by one government or one state. We really are looking to the federal government for help, not just for the county, for county services, not just for our nonprofits that we contract with, but for all of our businesses in the entire county. And so I have another ask for folks today on the call. We just learned that the CARES Act that the federal government passed, which was much applauded and lauded, has a carve out that may mean that Multnomah County doesn't receive any of those funds. And so we're contacting our congressional delegation, and I would ask that you all do the same. There are 26 counties around the country that are in a similar situation that Multnomah County is in, where we have a city within our county that is over 500,000 in population. And if that population is taken into account, then those counties, 26 of us around the country, won't receive any funding. And for a county like Multnomah County, where we are the public health authority and we are responsible for being the safety net, this could be devastating for our ability to help our community respond to the outcome of this crisis.
Thanks for flagging that. I think that'll be a key effort of the business community to make sure that those resources come here to Multnomah County. We had Senators Wyden and Merkley on for the first version of this digital conversation, and the House passed the CARES Act in the middle of that broadcast. So I think I'm sure our Oregon delegation will be able to work with us to get that done. It's a really important thing that needs to happen. So thanks for raising that to us and to all of our members. We'll make sure to have the information out to you on how you can be effective in being advocates for the county. So I do want to move into a conversation that has come up a lot. This organization, the Portland Business Alliance, and I think any resident within the Tri-County region really cares about homelessness as an imperative and making sure that we're addressing services to those who need them the most. And it's an important note to make that our county manages, Multnomah County manages our homelessness services, as well as our correctional facilities, as mentioned earlier. But I want to ask you something very specific to the unsheltered population. Tell us a little bit about how you're working with the unsheltered among us to get the information out. And for those that are struggling with chemical addiction, mental health needs, this has got to be a big challenge. So I'd take both your responses on how you're working through that in a big way.
Sure, we know that we have a lot of people sleeping on our streets, and I talked about the new shelters that we've opened up, and those have not added additional capacity. They've been necessary to make sure that the people who are currently in shelter can be adequately spaced, ensuring the health and safety of our residents and the staff. So we know that there are still far too many people who are sleeping on the streets. So right off the bat, the first week of this crisis, we deployed 14 different organizations throughout the county to distribute hygiene supplies, blankets and tarps, and also information, so that people got directly information about 6 feet social distancing, hand washing, and obviously that's difficult. So if you don't have running water, so the hand sanitizer was crucial. And then as we move forward, behavioral health issues are at such the forefront of all of our minds. And that's one of those areas that's really been exacerbated by this crisis. We still have our Multnomah County crisis line up and running and fully staffed, so people can call in and get support. I know that there are other nonprofit partners in the community like Lines for Life who are fully staffed and up and running. So there are some resources, but it is much more difficult. And I will quote Dr. Vines here, because she said it so eloquently a few weeks ago, that this crisis has just uncovered the other many, many crises that exist in our community.
That's a great point. So I want to move into just a piece. You brushed on this a little bit, but I think it's really important for folks to understand the Multnomah County business income tax and what the impacts of that will be in this year. And specifically, I'm going to tie two elements together. You mentioned a little bit about corrections and the role that the county has played. You spoke quite a bit at your State of the County about the interventions you're making in our prison systems, in our corrections facilities. So I just want to get through this question with you, which is the Alliance worked with you this year to come up to an agreement on an increase in the Multnomah County business income tax, which also includes some significant cuts. You mentioned that to small businesses. I think it'd be important for you to maybe walk through for our members what that means. That agreement was primarily meant to close a $27 million structural deficit, and that situation is clearly going to deteriorate significantly as we move through this economic crisis. So can you give us a sense of the updated revenue projections or sense of what the hit to county revenues are going to be? And I know that is probably a futile task, but it's a really key component for folks to understand at least the approach that you're taking for developing your budgets in the future to continue to deliver, especially on the correction side of these things and these interventions you're making in the jails. How are you going to deliver on understanding for approaching the budget going forward? Because this is uncharted territory.
Yes, as you mentioned, we were in a budget deficit before this crisis started, and thanks to the partnership with the Portland Business Alliance, we were able to increase the business income tax on one end, but also bring up the other end where 14,000 small businesses in Multnomah County will no longer have to pay the tax at all. So it was timely in that way, and we had hoped that with that new investment, we would be able to make additional funding in areas as well as ensure that we were not going backwards. Well, we're really in a whole new world right now, but as I mentioned in my opening comments, we also had the burden then of the legislature coming back and telling us just a few weeks ago that they were not going to have the funding for the $1145 that we've been in partnership with the PBA advocating so strongly for, and that meant those funds go to support one whole dorm in our jail. So I'm currently working on my FY 2021 budget and taking into consideration that in any way we can to hold those essential services from being cut. I'm just so thankful to the businesses who are able will be making a profit next year, that they will be able to help us shore up the foundation of our essential services. So at this point, I am not seeing drastic cuts to our budget, and we're keeping our eye on things as they move forward. But we will be in touch. The executive budget comes out May 7th, and that's when we'll start the budget process, the public process, which we may have meetings like this to talk about our budget, so we'll have more time to discuss it then. And then we vote on June 11th.
Great. Thanks for the timeline. We'll make sure to stay in touch as we move forward. Now I want to start to aggregate some of these great questions that are coming through, and I've noted 3 folks that have asked somewhat of a similar question. So I think I want to dive into it on the really hopeful end of things. So first off, Dave Chown, I know you're out there. You're a great member. We really appreciate family-owned businesses. Ralph Cole, who's with Ferguson Wellman, great financial wealth managers out there. And Dr. Anna Waters of Green Hills Pediatric Therapy all submitted somewhat of a similar question. And really, it's centered around this. And I think folks are wondering this question. This is probably for you, Dr. Vines, first to get a sense of the health aspects, and then from a county aspect to you, Chair Kafoury. But how are you looking at, what are the indicators you need to see as a county health officer for when you can start to advise your partners in policymaking as to when you can reopen businesses? How does that even look? I mean, how do you even advise on that matter? And then what are you looking for, Chair, to hear from your public health experts to get that signal? What's the feedback loop that you all need to make those decisions?
Yeah, thank you. I think that is the question for public health right now. So we're focused on surge planning. At the same time, we're just starting to think through exactly that question of what would tell us that it's safe to relax some of the social distancing, for how long, what are the implications, what would be the other protective measures we would need to have in place. And mostly we're really trying to make this a local data-driven decision. And so again, as cases go up, unfortunately, we get more and more information about who this is affecting, how it's spreading in our communities. And I feel like my metaphor is that a very sort of grainy photo starts to slowly come into focus for us. And then we also, of course, benefit from learnings from other jurisdictions and countries who are ahead of us in this experience, and start to get a good look at what tools we might use so that we are not permanently social distancing, which I don't think anybody thinks is realistic. So, Madam Chair, I don't know if you have more to add.
I would just say, as someone who's not a hugger, I'm actually kind of enjoying this social distancing thing. Sorry, a little humor. It is a very, very complicated and challenging issue that we are grappling with. And I think it's not just one made by the health officials or one made by elected leaders. We need the community in this conversation as well, because as I said earlier, we do want to slow the spread. We do want to control the virus, but we know that this is devastating to many families and individuals and businesses in our community. So how the how of reopening our community, opening businesses, relaxing the social distancing, the how we do it is just so crucially important, because we don't want to take all the good work that we've done and throw it out the window. And we also know that our economy and our neighbors are hurting right now. So I think that as we are looking to those next steps, there will be a lot of more communication with all of our partners.
Great, thank you for that. And I just got a very thoughtful question from Pari Mazer. If I said your last name or first name incorrectly, I'm sorry about that, but is with Cascadia Behavioral Health, who is a PBA member. Thank you for your membership. Although we are all in this together, we know that different communities have been impacted differently. How are we discussing or planning to meet the needs of the most marginalized communities, in particular immigrant, refugee communities, or transgender, LGBTQ, disabled, on and on? I think I just really appreciate that you asked that question. I think this is one of those impacts you just don't know when you make such drastic actions, and I'm very curious. And first off, appreciate the question and curious the answer.
Sure. Well, as you know, this is something that Multnomah County focuses on all the time. So we take equity extremely seriously at our county. Our emergency operations center has staff liaisons, specific staff liaisons to the LGBTQ community, to the faith community. We have an equity officer actually embedded in our emergency operations center. And we've trained more than 50 community health workers to go out into the community, trusted folks from those communities to talk directly with their community members about the virus, about how it hits, how it works, how to stop the spread. Today at 1:00 p.m., we are having our press conference with diverse health leaders from Multnomah County, Virginia Garcia, Wallace Medical Concern on chronic disease and how this virus, like every other disease, is hitting people in a disproportionate manner. So we need to get that word out. We also are working to have a Latinx community-focused outreach conversation in the next week. And you will see, I saw somewhere from the comments that maybe our data dashboard link wasn't working, so we'll try to get that fixed. But if you click on that data dashboard, you will see that we also have demographics, race and ethnicity demographics on that dashboard. And it's my understanding that we are the first place in the country to have such, in Oregon, the state of Oregon, to have those demographics highlighted as well, because it's important for our community members to have this knowledge as we move forward in slowing the spread of this virus.
Great, thank you for that. I do want to take a good comment here. Sherry Dunn, who's at Dress for Success Oregon, also a great PBA member. Sherry, I hope you're doing well. She's from the great state of Wisconsin originally. Many nonprofits are still waiting for support, and those that are not considered to be front lines, and that's a critical distinction. Obviously, we're prioritizing frontline providers, vital services, and that need is good. But for you, when you move on, you move into the reopening of society. She's asking that the need for help after all this is over. What can the county do for nonprofits like Dress for Success and others who are going to be part of the recovery process? And she does great work, and so does Dress for Success. So give a little context for how we might be thinking about non-frontline service providers that are nonprofits in our region.
Sure, and as I said earlier, the scale of this, the response and the recovery is going to be enormous, far beyond the means of Multnomah County to solve. And I have been so heartened by the community stepping forward, the faith community, the business community, the philanthropic community. We know that the Oregon Community Foundation, just in and of itself, with their partners, has recently put forward $2.5 million. And I expect that they will be doing more. Individual businesses have stepped up with millions of dollars to aid in the recovery. Mm-hmm. And I believe it's going to be our job to help those nonprofits, especially some of the smaller ones, get their voice out there, to get in front of organizations that have dollars to distribute. And then hopefully we will have some funding from the federal government, from the CARES Act, so that we ourselves can be a partner in the recovery of our nonprofit partners.
I think that's a great callback to originally what you asked for all of us, is to make sure we're at the table with the CARES Act and making sure that this county specifically is able to access that funding so we can help great nonprofits out there that are delivering on some serious aid to our communities as we move forward. Have something here from Dean Funk at PGE, a great member, and also is the current chair of the board of the Central East Side Industrial Council, and asking a really good question. This one was teed up in a report this year that PBA produced for part of our annual Value of Jobs Coalition presentation. So here's the question. We have a deficit of housing units in our community, almost nearly 25,000 short over the course of the past decade. And since construction is hampered, what can you do or are thinking about to ensure that housing construction continues or is accelerated post the lifting of major restrictions?
Well, as you know, Dean, housing and homelessness is top of my priority always. So this is something that is really important. We know that one of the reasons why we're in this housing crisis is because we have underbuilt year after year. Unfortunately, I don't think that this is going to be the year that we bend that curve, but we are still committed. Thankfully, this region and this city recently passed 2 affordable housing bonds, and so those measures are still going forward, and those housing units will still be built. Housing construction has not, it's slowed, but it has not stopped. That was not one of the directives from the governor in her recent executive order. I know that the city of Portland is working to ensure that BDS stays open so that people can have access. Even if they can't come in face to face, they have electronic virtual access to get the permits needed to create those that housing. And in ways that we can, we of course are very, very supportive to make sure that that housing continues.
That's great. And then I just want to lead into this general question here for you. As you know, the Alliance is part of the effort to develop and refer the Regional Homeless Service Measure, which is on the ballot next month. Who would have thought? Boy, time does fly. If it passes, it will provide the county with a major influx of resources starting in 2022. It's hard to imagine next week, let alone 2022. To ramp up critical services to reduce the unsheltered street homelessness and prevent more families from sliding into homelessness. Can you give a sense of what the impact of this will be on the unsheltered community, what the need will be for these services going forward now that this crisis has just landed on all of our laps?
Yes, well, I want to give a big shout out to 3 very prominent members of the business community, Goon Denhart, Tom Kelly, and Stan Amy, for their very thoughtful op-ed in yesterday's Oregonian, which I thought just so clearly articulated how the need for this ballot measure is now going to be even greater than ever. We know that the funding in this area is lacking, and that was why this measure we've worked on in conjunction with the PBA and many local partners to create a framework that will ensure that it's big enough to make a dent. Now, that's obviously those projections were before this crisis, but I still feel more committed now than ever to ensure that this measure passes in May. And it's going to be a challenge, just getting the word out about the need, about the measure, in the midst of a 24/7 news cycle that's all COVID all the time. It's going to take a lot more word of mouth, I would say on the ground, but probably virtually on the ground, communication with our partners about making sure that people get out and vote. Luckily, we have a vote by mail state, so we don't have to teach people a new way of doing business, but trying to get the traditional get out the vote methods and the traditional campaign methods are just going to are not really the ones that we're going to be able to use this go around.
Yeah, absolutely. And just to plug, that was a great, I'm glad you pointed out, that was a great letter to the editor. It was in the Oregonian yesterday, Sunday. It's really important folks know local media has never been more important. And obviously advertising dollars may not be appearing as much as they used to. So subscribing to our local media outlets is really important to make sure that the journalists covering all of this and getting us the information that we are really clinging to right now in a big way, and getting out the good work of folks like Dr. Vines and like Chair Kafoury into our hands is really important now more than ever. And it was really thoughtful, and I think we do need this more than ever. So thank you for pointing that out. I want to move into a question here, and we're going to take maybe 1 or 2 more. This is from Tyler Termier. Again, apologies if I've mispronounced your name, from the Cascade AIDS Project and Prism Health, which is a PBA member. So thank you, Tyler, for the membership. And Tyler says this: I hope that we can engage in some thoughtful community discussions about how we relax social distancing, especially if a recommendation for the community to wear cloth masks still exists at that time. There's a great article for review about why some communities may not feel comfortable wearing a mask in the Boston Globe, which is titled, "As a Black Man Living in Portland, I Want to Stay Alive, but I also want to stay alive." So I think it's a really interesting series there. So maybe just talk a little bit about how do we manage to unsocially distance in a responsible way from both a health sense and a community health perspective, as well as mental health perspective?
Sure, and I'll take this, and then maybe Dr. Vines could add something, because I know that these are exactly the kind of conversations that we've been having in Multnomah County since the beginning of this pandemic. For example, the social distancing issue came up in how we effectively communicate the need for appropriate social distancing in communities where there's, you know, the cultural emphasis on close contact is different depending on what community you come from. So we've taken this conversation very seriously and started early. We actually are in a conversation right now with the Department of Community Justice about further guidance for covering your face, especially when the fabric or the way you style it really means something that might not, you know, that as Tyler pointed out, might actually put someone's life at risk. So these are all important questions that we're looking at, and it just really shows you the depth and real thoughtful perspective that Multnomah County, through our public health lens, through our Department of Community Justice, through our outreach into culturally diverse neighborhoods and communities, how we're utilizing all of those as we make these decisions moving forward.
Great, and I'm going to take two questions and sort of loop them together here because they're sort of at the end of our Q&A moments here, but Dion Dallas at Other Venue, and William Miller at the Native American Youth and Family Center, who is a PBA member. Thank you for your membership. Really, these are on timelines. So I guess putting on your, or taking out your crystal ball or whatever it is that you use to see in the future. Talk us through your expectations for timeline and what does recovery look like to you? And I think those are two really big questions, hard to answer, but it's worth the question, and I think really dovetails nicely with what you just brought up.
Dr. Vines, did you want to kick that one off?
Again, thank you. That is the question. I think with the projected peak of late April, early May, I think I'll be interested to see where we are a couple of weeks from now, if we think we're on the upward slope of that trend, and how steep is it, how high is it, and then I think we start imagining maybe what summer starts to look like in Portland based on modeling, based on what we know from our case investigations at that point. And just as the last question pointed out, what we as a community are willing to do and share the burden of this virus as equitably as we can.
And I will add to that and say, as I mentioned in my State of the County on Friday, I really expect to spend the remainder of my last term as county chair over the next 3 years focused on the recovery. I think this isn't a one and done thing. This isn't, you know, we have 2 weeks of closure and then we open and bam, things are getting back to normal. We know that it's going to take a long time to get our community back on its feet. And how we do that is just as important as how quickly we do that. So we're going to be working together, and I know it's going to be challenging, but having conversations like this one really is important as we move forward, because none of these decisions can be made in a vacuum. The effect and the reverberations throughout so many different parts of our community are real, and we want to hear your thoughts and your concerns as we move forward together.
Well, I just want to pause here, say thank you to you both, the county and the role that you play in public health. That is your role. It is what we are all looking to both of you and your entire teams. We know this really is a team effort, and to all the employees that are on the front lines of service from the county, we just want to say our sincere gratitude to the work that you are all doing, and we know we're going to get through this together. So our appreciation, if you want to share any last thoughts, Chair Kafoury or Dr. Vines, please do.
I'll just say thank you, Andrew, and thank you to the Portland Business Alliance for your partnership, and thank you to all the businesses who participated today. Please feel free to reach out and contact us if you have other questions that came up and you didn't get answered, or if you have questions that come up in the next few days, I hope we can do something like this again soon, because things are changing so quickly and so rapidly that information that goes out one day, guidance that goes out one day can change within just a couple of days. So having more communication has never been more crucial than it is at a time like this. So thank you.
Absolutely.
Yeah, thanks. And I'll just echo that gratitude and say again that we're very narrowly focused on preventing an infection right now. But I just want to reassure and thank the audience today by saying we absolutely recognize that business plays a key role in a healthy, thriving community. And for all the conversations and questions about equity, these are top of our minds. So it's helpful to hear them from you. It's helpful to talk through them with you. And again, we are doing our best to balance many competing, difficult interests, and it's going to take all of our wisdom together, I think, to come up with the right answer and solutions for our community. So thank you.
That's great. Thank you so much to you both. Thank you again to Northwest Natural, our event sponsor today, that made this possible. And another note for a save the date, this one actually is relevant here for Multnomah County, of course, but we have, just similar to moving these discussions to an online format, as folks know, as part of the Alliance event schedule, we host monthly forums. We had planned on having a discussion between the two candidates for district attorney. We are now holding that on April 15th. It will be a forum and a discussion between both that are running for Multnomah County District Attorney, moderated by Noelle Crombie from the Oregonian. Make sure to register at our website, and we will continue to post all the great updates from our partners at the county at portlandalliance.com/COVID-19. Stay healthy, everyone. And again, thank you to Dr. Vines and to Chair Kafoury. Have a great day.